Good morning, everybody. Right now it's 11 o'clock. It's the Academy of Acupuncture. This is Dr. Eileen Yue Ling Han, the director for the Academy. And it's all, again, our Sunday share. Every Sunday, 11 o'clock, we have this wonderful time for sharing balance method, information and practice and case study from all the practitioners that have learned from Dr. Tan from all over the world and from everywhere, from all different courses. Everybody are practicing with Dr. Tan's balance method. And then everybody practice more than some people 10 years, 15 years, 30 years. And today I invited Diane Iuliano, and she is already here with us. Just say hi. And then I like to introduce her to you. So, Diane Iuliano is a world-renowned teacher and practitioner of acupuncture, currently sharing her wisdom and talents from Belmont, Massachusetts. Diane has been practicing medicine for almost 30 years. Her expertise in Eastern medical therapies, including a specialty in shakuju, serves as her expertise as a co-chairman of the Japanese program at the New England School of Acupuncture and also the Massachusetts College of Pharmacy. We are honored to have Diane share her insight about the discipline of acupuncture and the dynamic of her leading her busy private practice at the acupuncture therapy in Belmont, Massachusetts. Let's welcome Diane. Yay! Thank you everybody for joining us to the Facebook today. Wonderful. And let me see, is everybody on Facebook? Excellent. Good, good, good. So now, yes. All right. Hi, Diane. How are you?
I'm good. I say good morning, good afternoon, and good evening because I don't know where people are. But it's
Yeah,
great to see you, Eileen. It's been a couple of years.
correct. Finally, I have a chance to invite you over here to join us for this wonderful meeting together and share experience in life. I know you learned from Dr. Tan long time ago, and I also know that you practiced already before you learned that from Dr. Tan. And tell us, how did you find out Dr. Tan for this balance method that you learned from him?
Well, I think I met him first in the late 90s. And at the time at New England School of Acupuncture, they would do pretty much every weekend, we'd have different continuing ed classes. And I believe it was Bill Muller who invited Dr. Tan over. Um, that was before he started teaching at NISA. So that was my first introduction to him. And I was immediately captivated because it's so, as you know, I practice mostly Japanese style. And there's a specific style in Japanese acupuncture that's very similar to the balance method. It's called Shigo. So it's basically doing the opposite on the Chinese clock. So he grabbed my attention immediately with that. And then when he started talking about how he gets his best ideas while he's sitting in the bathroom on the toilet, I thought that was
Yeah.
fascinating.
Yes, that was a story of 12 magical points.
It was very interesting. In his classes, he had 50 to 70 to 100 people every single time I went. I think it was probably 15 to 18 years that I studied with him. And
Yeah.
he was just so generous with his knowledge, with his kindness. He was generous with his wallet every time after class when we went to have a martini or a glass of wine, and we'd always discuss cases. So I just kept going to classes. So it was 12 and 12 and 24 more in acupuncture 1, 2, 3. And I remember bringing my difficult patients, the
Yes.
patients who didn't respond the way I thought they should, to his classes, and he would treat them. So that was also a very unusual and very great learning experience for me as well. Because, it doesn't matter how many years you have, nobody can treat a person all the time and get the results they think they should get. So it's always good to have a teacher's, experience with them. So that was
Yes,
fascinating
absolutely.
and
And then
valuable.
I heard you said you went to the happy hour, discuss case with him,
Yeah.
acupuncture case with him. You must be very special because there's no way anybody can talk about case study after the class.
Well, I don't know if you remember, but there was one time we were at the Regatta Bar in Cambridge, Mass. Terry Olson was there. Terry
Yes,
Olson is very big with the auricular
yes,
acupuncture, and I'll
here.
share some of that a little bit later. And so Melissa was there, you were there, Joe Kay was there. We were all talking about cases. And I called Dr. Tan Richard just because I'm bad like that. And he turned to me and he said, because Terry was, doing something with my ear.
Oh my
And
God.
Dr. Tan
Oh
said,
my God.
is he having ear sex with you? So, there was
Oh
that
my.
side of him. He was so focused in class. He was so honed into what was going on. He could diagnose somebody in less than a minute, and he'd get the points into somebody in less than 2 minutes, and the patient would get better. So, what more could you ask for? Somebody who would give you his knowledge, somebody who would share a meal with you, and somebody who would share a laugh with you. It was great.
Yes. That's why I remember when I first met you, I was selling acupuncture supplies.
Yes.
And then I was sitting right in the big giant seminar room, and you will be helping organize everything. And then you will come to my table and says, "Oh my God, you sell all this nice equipment and supplies. We will please give me your information, and then we will purchase from you." And since then, and after that, and then after the class, we will hang out all together all the time. That is so awesome.
Where did we go? Summer Shack to eat lobster.
That's right. That's right. Summer Shack for lobster. I remember. Yes. When you go to Massachusetts, you have, yeah, Boston, you gotta eat Boston lobster. Correct?
And go tango dancing.
Oh yes. Do you, is my Boston sound like Boston? Bostonian?
Not
No.
as bad as I do. I get made fun of all the time by my students. Computer, teacher.
Oh yeah, that's a very, yeah, I can hear your accent. That is awesome. So let me welcome those people from Linwood, Colorado. That's Mark Montoya. Hiroko from Canada and Portugal. And we have Hongli from France and Julie from Canada, I think Toronto or Alexandria. So we have a lot of people here. Please let me know who you are and where you're from, where, so we know where we're sharing all this information to all the world, the Balance Method family. Okay, Balance Method family. Every one of you are part of the family. Thank you so much for joining us. And tell us continually, after Dr. Tan went back to Massachusetts teaching, and I do know that you have learning every single classes, and I do know you love the extra meridian balance class.
Correct.
And then also you learn a lot of scalp acupuncture, and Dr. Tan also taught a feng shui class
Yes.
over there in Massachusetts. Tell us more about a little bit about all the classes that he has with you guys?
Well, I believe for at least 10, 12, maybe even 15 years, he was coming at least twice a year to Boston. And then he started doing the certificate program. So most of the time I was at NISA. Sometime the class was too big that we couldn't fit at NISA. So we would have to go to a hotel.
Right.
And it was all the same faces. So it was great to see people who started from 12 and 12 and then moved up from there. And I don't know if you remember, but Joe, Melissa, and I taught in Tokyo, Japan, the balance method, in Hokkaido, Japan, and in Barcelona. So we always wanted to get him to come with us to Japan, but you've been there, haven't you?
Yeah. I
Yes.
taught there last year, October. It's already a year.
Wow.
Yeah.
I was supposed to be there this month, but with COVID, that's
Yeah.
not happening. But it was, I used to have these discussions with Dr. Tan about, because my tendency with the Japanese acupuncture is to use #1 Sarin needles. And he would always use the really big needles and he would thread points. And I'd have these discussions with him and I'd say, Dr. Tan, why do you use such big needles and go in so deep into the body when I just insert the needle maybe 3 millimeters and get the same results? And he looked at me like I was crazy. And you know what he said to me? He said, Diane, if the theory is sound, it will work.
Yes.
Said, you have to be confident. You have to be competent in what you do. And if you know the underlying theory, it will work for you. So that was, again, another reason. He never judged me because I didn't practice the same way everybody else does. He never was judgmental about any of that. It was fantastic to be with. And, you always learn something from him. The only thing I never learned was how to eat an oyster, because that just never appealed to me. You guys would be sucking down the oysters and I couldn't get into that.
That's okay. That's okay. We still have chance. We have time. I'm just kidding.
That'll be
Yes.
Melissa's job.
Okay.
So I think one of the other things that I really got from this, especially with the extraordinary vessels. So if I could give you an example of, say, a patient comes into my office and they have right sciatic pain that's, on the lateral aspect of the leg. Of course, I would take the pulse and palpate the belly because that's just how I was originally trained. But
Yeah.
what I would do if the sciatica is on the right side and it's like a Daimai sciatica, I would do the Daimai on the right side of the body and then go to the opposite side and use the opposite on the Chinese clock and use heart points that would mirror where the pain was on the right side of the body. So to me, that was a beautiful, fantastic treatment where you're doing a root treatment and then you're doing the symptomatic treatment on the opposite side of the body. And it works, like he said, down and dirty, works really fast.
Yes. And then if you want to tell anybody any cases, people might want to hear some points.
Well, I had a very interesting woman. She was referred to me actually via somebody in Japan. She actually lived in Greece. She flew here to see me, which was bizarre in and of itself. She had had a stroke 2 years earlier, and most of her deficiency was, again, it was her right arm. It was mostly small intestine channel. She hadn't been able to raise her right arm for almost 2 years.
Mm-hmm.
So this was actually filmed by Channel 5 here, so people can look it up to check it out. So
Channel
I
5?
did Channel
Channel 5
5,
Massachusetts?
WCBB, yes.
All right, guys, WCBB, please make sure you go online, check that out, okay?
I don't know how long ago this was, but I remember I did the Dumai on the side where she couldn't raise her arm. And on the opposite side, I did liver 4
You need the small intestine 3 for the do mine?
small intestine 3, bladder 62. And
Ah,
then I would do on the opposite leg, because it was her arm that was affected, I would do liver 4 to Dr. Tan's liver 8 point.
yes.
And once that last needle went in, she was able to raise her arm all the way up. So that was the most extraordinary thing that I've seen happen using the balance method, for a patient who for 2 years had no movement with her arm.
Wow.
That
Wow.
was,
You were saying that small intestine 3, UB62, and liver 3 and liver 8?
I did, I think, liver 4
Liver.
up to liver 8. So I would, how he said it's only 1 point, but he'd have 6 needles in that 1 point. So I'd be pushing for painful spots and um, needled all the way up from liver 4 to liver 8. So
Wow.
that was great.
Wow. I think people really like me right now because I keep on pushing you for the points. It's
Oh,
okay.
I'm used to teaching. It's okay.
All right, because I think they are spending 30 minutes of their time to join us to the Balanced Method family. They want to get some points back home.
Well, the other thing, one thing, when I was going to acupuncture school, I worked for otolaryngologists, which are ear, nose, and throat doctors. And the one thing that Western medicine has a really hard time treating is tinnitus or tinnitus, depending on how you say it.
Right.
So it was Dr. Tan's tinnitus point that was here
Right here,
that
yeah.
really turned things around for me. So I would do points around the mastoid, like say triple warmer 17, triple warmer 20, maybe gallbladder 12. And then when I put in the tinnitus point, it was on the same side, which was interesting, not the opposite side.
Opposite.
The
Mhm.
patient would get relief from some of their, from the ringing in the ear.
That's wonderful.
So that was another clinical pearl that I thought was awesome.
Well, what is the tinnitus points on the shoulder?
Well, basically it's in between large intestine and triple warmer. It's in the middle. And then you come down, I want to say about 2 inches, but you can definitely feel there's a little depression there.
I think that one is also as a high blood pressure point.
Well, that would make sense too.
Yeah.
Yeah.
There's also high blood pressure points. If you guys want to know what that point is, you need to go get the book. It's 12 or 12. And I think it's saying that 12 and 12 or 24 more. And so I'm going to do a little commercial. I also will be in my book and book 2. And book 2 is coming up hopefully next month. I will publish my book 2. It's also in that book 2. And the power of the point. Yes, that is how I remember this point because I would do this. So that will be the point right here. Can stop the nose running and can also treat the high blood pressure. So that is the points. Yes, thank you very much. That is a very, very valuable points that people, if they don't really pay attention to it, and Dr. Tan has a lot of good books, and please purchase it from drtanshow.com. Mrs. Tan is selling Dr. Tan's book. So if you need the books, please go over there and purchase your book. And if you want to purchase my books, it's going to go to the Academy of Acupuncture. Thank you for sharing that really good one. So you will do around the GB and then you will put the needle at the same side. I'm going to go home. I'm going to go back to my clinic and practice that too.
Well, patients with tinnitus, it really drives them crazy because there is nothing Western medicine can do for that. So when they get even a little bit of relief when the pitch is down a little, it just gives them so much comfort and so much peace of mind.
Yes, I agree with you. Absolutely. Yes. So yes, tinnitus is a really important treatment because a lot of people has it just like you said. I want everybody who's watching right now, please go back to your clinic, practice on that, and then we come back and we can talk more. Okay, so next time when I invite Diane back, so we can hear your report from that. Okay, everyone?
Yes.
Great. So Diane, I also know you also helping your community, your acupuncturist community over there
Yeah.
about the ear. You're taking some of the information from Dr. Tan's feng shui face reading class, and talking about the ears. Can you tell us a little bit more about that? Because I believe everybody all excited about all the pearls that you share with us.
Let me see if I can share this screen. So can you see this?
Give it, let's see. Share screen. Yes. Not yet. Oh, yes, we can see. Excellent.
Okay, so this was basically, I've been teaching auricular acupuncture at New England School of Acupuncture for almost 30 years. And when I took the facial diagnosis class with Dr. Tan, he taught me some really important aspects of the ear that I hadn't thought about before. You know, and I'm sorry, my phones keep ringing. So, you know, if you look at people's ears, their left ear is different than their right ear. And looking at where vascular spiders are, looking where hyper and hypopigmentation are, is a very important diagnostic tool. And Dr. Tan would always talk about, you know, also look at where the ear is placed on the head, if the ear is sticking out, if it's close to the head, if the anti-helix is sticking out. So he would teach that if you see somebody and you meet them and you look at them and their ears stick out, this of course has to do with wind. So this is a person who travels a lot, whether it's for their business, whether it's for you know, personal interest. They do a lot of running around. And this person tends to be more famous away from where they were born. So it would be like if Dr. Tan was born in Taiwan and he lived in San Diego. So this would be one instance. And then my students think this looks like me, but I'm telling you, it's not me. But if a person has a high ear, that is an ear that comes up above the corner of the eye or the eyebrow, it's considered a high ear. And this person has a tendency to pursue academics. So it'd be somebody who's crazy like me, who's old enough to know better, who's going to get her doctorate when I should be sipping margaritas somewhere.
Oh, you're taking your doctor program?
At PCOM. It's a wonderful, wonderful program. I highly recommend it.
Yay.
So this is the opposite of the high ears, a person who has a low ear. And that's if this person has, if their top of the ear is lower than the eye, this person has a low ear, and they tend to be more intellectual than, say, the person who's running around traveling. Now we need to pay attention to this during COVID with the economy that's going up and down and all over the place. You want your financial investment manager to be a person whose ears are attached or close to their skull, because they're very good at the stock market, they're very good with investment and with management. I don't know, my ears are kind of sticking out a little, I think. I don't know.
What do you think about my ear? Can we just tape my ear like that? Do you think it would be okay if I tape
I
my
do
ear?
know people who've had that done. You can tape them back or have them surgically stitched back. Or if
Oh
you're in my auricular class, the students needle the ear to the head. That's not a good thing.
my God. Okay
And,
then.
and then this is the last one. And somebody who's anti-helix, and that would be, you know, this aspect of the ear. It's not the outside, it's the cartilage part of the ear. This is the anti-traditional person. So this would be the kid who broke all the rules, who never did anything, you know, somebody who this would be the kid who's in bed with the sheets over them and a flashlight reading a book. They tend to be creative. I think this was Dr. Tan, because he certainly broke all the molds. And I like animals, so I had to put this little goat in there.
Ah,
But I think it's just another way. So instead of just looking at a person's ear and saying, well, they've got a vascular spider at the hip point, it tells you something about their personality. You know, are they good with money? Do they like to travel? Is this person creative? Is this person intellectual? So his face diagnosis class was very important to me because I used to be a painter, not painting houses. I used to do fine arts. So I was definitely into, looking at people and getting something. You look at the color of a person's face. How is the shen in their eyes? So that facial diagnosis class was very important to me, and hopefully we'll be doing something in the future with that.
Yes, yes. I've been gathering all the information that I can, trying to bring back the feng shui class and the face reading class. So I'm still working on it. Hopefully 2021, I can duplicate it, the class again. But I'm just trying to work it out. All the slowly pushing out all the classes that he has been teaching, and I can see that maybe I can invite you to teach the extra meridian class.
Sure.
4 hours, that work?
That's what the classes are now. It's crazy. Couple of other things I was thinking of with when the patient comes in, say woman has menstrual issues, infertility. One of the lessons that I learned from Dr. Tan was when you mirror things, it's not only the right shoulder as the left ankle. If somebody's got issues with the renmai, you treat the dumai. So I would do my insight onto that. I would do the points that were tender as you go down the dumai or the bladder meridian, but then I would add moxa, whether it's moxa pole or direct moxa. I think there was one patient who came in, he used is it piezo, the pen?
Yeah, pachi pachi. Mm-hmm.
Yes, pachi pachi. And that was really effective at warming the pelvic girdle, getting rid of, menstrual cramps or any cold in the abdomen, and also to help with infertility. So that is something I'd really never thought of before. And that was also a good learning experience for me.
You remember all the details. I like that. He
Well,
showed me a lot of things.
you have to remember because we have class, then you have a martini, then you go get lobster, then you go dancing. It was all good.
And then you have to remember it again and again. That's why every time he comes back, you always go to the class and just to listen again and again. Then you will always learn something new.
Oh, always. That's why I always went to the basic class, because there's always something he would tell me. I try to, for this class, I have a set of his overhead transparencies, but
Yes.
I moved from an apartment. I bought a house. Yay. And
Yay.
I can't find them. So they're somewhere here. I just don't know where, but I thought it would have been really cool to hold up one of his transparencies for people to see his handwriting with the little stick figures on them.
Yes. That's how we do it right now. Everybody's just inherit the idea using the little stick man to write down the patterns, the treatments. So that, yeah, that's wonderful. That's awesome. Yes.
Good.
Yeah, there anything else you want to share with us? Any fantastic case study that you're thinking that you want to share with us?
Well, this is probably a little bit of an aside, but I was in a cab as as a rider getting driven somewhere, and the cab driver kept trying to turn his head, and he couldn't turn his head, and I was getting really nervous because you're in a car with somebody, you want them to be able to have full range of motion. So I just asked him to give me his wrist, and I didn't have needles with me, but I just started pushing on like large intestine 5, small intestine 4, triple warmer 5, and he was actually able to turn his head. So I felt much safer in the car. So you can treat people even without needles, again, because the theory is sound. You just push on the points and you can give somebody greater range of movement and less pain.
That's right. Wow. Did you charge him for the service of the acupressure?
Let me tell you, I was just happy to get out of the cab.
That's right. That's right. Well, are you okay for sharing the screen again so people can see the year, the high year, the low year, the median, the year? Because somebody's asking if that they can see the slide again. Thank you so much. And there's
Sure.
another student also found out that page 35 of Dr. Tan's book 12 and 12 is called large intestine 14 is the one that we put it on the shoulder right here
Yep.
for the year that you guys can take a look. Okay.
Let's see if I can do this.
Thank you. And then there are people from Miami, Florida, people from Valdivia, Chicago, Halifax. Thank you, Julie. In San Francisco, they're all watching. Thank you for everybody. Let us know
Eileen, I
where
can,
you. Yes.
no, I was going to say, I can send this to you if you want to. I don't care if you send it to people.
Yeah,
It's
yeah.
all,
I can post it on the Facebook. If you're gonna send it to me, that'll be great. Yeah, this is great information for people to get to know. Yeah,
okay.
this must be Dr. Tan. I was
Yes.
I was trying to looking for his photos. Maybe I can show one of his photos here so people can see. He might be a rebel. That's the reason why.
Well, he was a rebel.
Okay. Sure, I agree. All right, everybody. And now it's the time for 11:30 and it's time's up. And thank you so much that we have Diane here and to share this wonderful information with us, how to tinnitus, how to treat the hand with the neck and stiffness. So now you know, even Diane's basic training is for Japanese style acupuncture, but she is really using her heart to learn the Dr. Tan's balance method, and she did a wonderful job. And then also she did a wonderful job with the extra meridians balance. So next year we're looking forward to have Diane to teach with the academy for the A extra meridian seminars. So thank you, Diane. I
Thank
love
you. Good to
you.
see you.
Mwah.
All right.
Thank you so much, everybody. She is at East Coast, Massachusetts. If you want to look for her, her acupuncture practice is called Acupuncture Therapies. It's at the Belmont, Massachusetts. I will post Iuliano. I will post her website onto our Facebook and onto our communication. Thank you, guys. Thank you, Diane. I love you. Mwah.
All right. Love you.
Bye.